Hey everybody, Dr. Farley here. I wanted to talk today about antibiotics, when it is appropriate to use an antibiotic, and also when it is important to complete the antibiotic. This is a frequent story that I get from my patients is a call and they say, oh, I felt bad this weekend, I had a sore throat, sinus infection, didn't want to bother you, so I went ahead and took the leftover antibiotic that I had. So I don't ever want to hear those words unless I have told you, like in the previous talk that we had, that I picked the wrong antibiotic and we're going to change it, and then I just want you to stop that antibiotic and start the new one. If you are prescribed an antibiotic, unless you are told that by your provider, the antibiotic needs to be taken to completion. And there are many reasons for this. Probably the most important is that if you do not finish that antibiotic and you do in fact have a bacterial infection, the bacteria will not be eradicated. The reason we have the number of days of a course of antibiotics is because through years and years and years of study, we have said, okay, in order to eradicate strep from your tonsils, from your throat, you have to take 10 days of amoxicillin at this dose. If you don't take the complete dose, the bacteria is lessened significantly. You feel better from a clinical standpoint as the patient, but the bacteria is not gone. So it will regrow, and there is the opportunity for that bacteria to regrow that is now resistant to that antibiotic. And that is something that we do struggle with a lot here in 2023 is antibiotic resistance because of one, overuse of antibiotics in bacterial settings when antibiotics are probably not necessary, and two, patients not completing the antibiotic as prescribed. So this is just an announcement and a talk to say if your provider gives you an antibiotic, take it to completion unless otherwise told. But hope that was helpful.